If elected, will Joe Biden be bad for your health care? Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to help navigate this turbulent world. Joe Biden claims he is opposed to the idea of a single-payer health care plan that would force all of us into a government-run system, such as exists in Britain, Canada, and numerous other countries where private insurance is extremely limited or non-existent. Instead, he says he favors a public option, that is, a government-owned health insurance entity that would compete with the private plans that over 180 million Americans have today. Who is he kidding? A public option is a socialist single-payer system by another name. Its policies would be subsidized by you, the taxpayer, just as Medicare and Medicaid are today. With those subsidies, there'd be no way private insurance companies could compete. They would either go broke or be forced to fold their operations into the new government entity. Shareholders would be wiped out, losing hundreds of billions of dollars. Proponents of the Biden approach point to Medicare and its allegedly low overhead. They conveniently overlook two inconvenient truths. One is, unlike private companies, Medicare is riddled with fraud, with estimates ranging upwards through $90 billion a year. And get this, for Medicare accounting purposes, fraudulent payments are counted as payments to beneficiaries, only in government. The second inconvenient truth, because Medicare usually underpays the true costs of so many medical procedures and tests, healthcare providers charge private patients more to make up the difference. And there's another ugly cost of a single-payer system that believers in socialized medicine overlook. Investments in research and development for new drugs and medical devices will wither. Government domination smothers innovation. Decades ago, Europe was a major source of new drugs, but as government became more and more dominant in healthcare, this flow of new medicines shriveled. With so many breakthroughs coming these days, particularly in the fight against cancer, and with progress desperately needed to combat Alzheimer's and other forms of dementia, this crushing of R&D would be an immense human tragedy. I'm Steve Forbes. Thank you for listening. Do send in your comments and suggestions, and I look forward to being with you soon again.